that actually was a book that was written by David Quammen that talks about all the environmental impacts that has led to emergence and reemergence of infectious diseases across the globe. If you all have a chance to read that book, I definitely suggest that as a reading for you all. So to start with this particular presentation, everybody talks about One Health, but for me, it's important to start the discussion on One Health with the understanding of what it actually means. What does One Health mean, and where did it come from? What are the origins of this particular One Health activity, right? So One Health is a concept that takes into account a relationship between humans, animals, and the ecosystem, if you will. We all occupy the ecosystem. We interact with the ecosystem. We interact between each other and between animals and humans. So when we talk about ecosystem, we're talking about wildlife, vectors, as well as domesticated animal species. And when you talk about an alternate definition for One Health, it is an approach looking at new diseases and other adverse health effects by taking into account a holistic approach where we are actually addressing diseases that are transmissible among animals and humans. It is not from animals to humans or humans to animals. It is among animals and humans. So think about this as interspecies transmission. The word One Health was coined by, or the terminology was coined by this person, Dr. Calvin Schwabe, who was at UC Davis, a pathologist, who actually looked at pathology as being a One Health concept as well, and then became a widely accepted terminology. So here I showed two pictures. One picture on the left where I'm showing this particular, let me see if I can get that. Does that, this one here, I'm drawing it. So this particular person is a person who works at the abattoir. One of the cultural beliefs in that part of the world is that people with pot bellies are highly blessed, and therefore they are from God. So when they die, people consume whatever fluid has accumulated over in the abdomen to be like them. But it turns out this is a hydatid cyst when it's pulled outside from the abdomen. And the hydatid cyst is a transmission of tapeworm from dogs to humans. And how does that come in contact? Think about the um, think about all the appropriate stuff that you would do. You are in contact with dogs, you're in contact with other animals. Dogs eat stuff from the environment. They get tapeworm. It's a very vicious life cycle. And this is generally how the interactions occur and what and movement in that particular movement of diseases in that particular fashion. So think about the host parasite continuum. Think about the holistic approach that I actually presented earlier, where there's an interaction between animals, humans, and the environment, and how multiple pathways of transmission can happen. If you look at the transmission due to encroachment or variation in the land use patterns or changing land use patterns, if you will, where diseases can spread among animals and humans. One example of zoonotic spread has been the Japanese encephalitis or Kiasner forest disease, which is a vector-borne infection. And the other is animal to animal transmission. And I show here a picture of a lion that is suffering from canine distemper. Canine distemper is basically a disease that is highly prevalent among domesticated animal species within certain parts of the developing countries. And when the land use patterns change and domesticated dogs go back and forth between the wildlife interactions versus interactions with people, you get and other dogs, you get multiple interspecies transmission events like this. And here's a lion with tuberculosis, primarily due to interaction with humans during tourism in South Africa. And here's a picture of a vector. This vector is a flea that actually transmits a disease you all may be aware of. It's called plague, and it's caused by, in the past, it used to be called Yersinia pestis. Now it's been renamed microbiologically as Pastorella pestis. And here's an example of the biggest killer in the whole wide world. And this is a mosquito that transmits multiple types of diseases, including dengue fever, malaria, West Nile virus, Japanese encephalitis, as well as a Casimir forest disease, in addition to other hemoprotozoan diseases, including malaria. And of course, rabies is one of the biggest examples that I can say that exists in the domesticated animal species, as well as in wildlife, which they interact with. And then the last one is to show you an example of some kinds of animal-to-animal interactions that can happen in the developing countries. And so there are multiple opportunities for spread of diseases among animals and humans. And I'm showing you examples which are primarily through urbanization type of activity. But if you do think about this, if beyond urbanization, you actually would see how our own dietary practices would also make a difference. So why should we care about emerging and re-emerging infectious diseases in global health? And why is it so important to understand the zoonotic and interspecies transmitted disease events? In between as of 2012 or so, 20 of the 27 infectious diseases, now 21 of the 28, including SARS-CoV-2, which are listed on the WHO global burden, are zoonotic in nature or interspecies transmitted in nature. And about 60 to 90% of the diseases that are infectious diseases that are transmitting among human populations have had at least one point in their life cycle that have gone through the animal species. And the true incidence and clinical severity for these diseases, some of these transmission events are not very well understood. Many times these things are happening in real time, consistently back and forth in terms of interspecies transmission. Think about it that way. And then what happens is at some point there's host adaptation by the pathogen that leads to a very significant spread within the human populations. And so some have very important transmission cycles, and we'll talk about some of those as well. I've given some examples here about trypanosomiasis, leishmaniasis, and Chagas disease. And some of the ways in which we interact with animals actually does make a difference. Think about how close we are to our animal species, especially our domesticated animal species. In one instance, you can actually get, let me try and get, sorry, wait a second. Get a laser pointer, it's better. So in this particular case, you can get Campylobacter, Salmonella, bovine brucellosis transmitted to people, and potentially tuberculosis as well. And in instances where kids are interacting with pigs like that, you can get influenza transmission, salmonellosis, Yersinia, etc., that can be transmitted from pigs to humans. In addition to tapeworm infections that can lead to visceral cysticercosis or cutaneous larva migrans or visceral larva migrans infections. So those are more common than in some of the bacterial infections that I talked about. So if you look at the environment itself and how the animals and humans interact with the environment and how they share these environments in different ecosystems across the globe, there's one example of domesticated pig that's basically eating garbage, and that's going to be consumed by people at some point or another. And so you can see how that gets recycled and transmission can happen, of diseases can happen between animals and humans. Here are the unhygienic use of water, also a source of major diseases, enteric diseases, including cholera across the globe. Here's an example of bovine tuberculosis in a human where it is manifested as a scrofula. Scrofula is the enlargement of a local lymph nodes in the retropharyngeal and mandibular lymph nodes. This should not be confused with mumps. It's actually tuberculosis. And when you open up the surgically resected version of it, you see a standard granuloma formation with calcified areas in the center, very typical of tuberculosis, but and human and bovine tuberculosis share the pathology and the lesion profile. But when you go in and actually ask the question as to which organism it is based on genomics and on its drug susceptibility profile, you can then identify that as bovine tuberculosis. And I'll give you an example of how I did these studies within my own research unit. And again, sharing of the environment between domesticated animals and humans and the source of infections. We shouldn't be surprised that there's a lot of, if we share the environment, if we share our ecosystem and we cross-contaminate, there will be cross-transmission of infectious diseases. And that's where One Health comes into play. And there is another angle to One Health, which I won't address here because that is a completely different kind of a presentation, because it includes spontaneous models for animal disease, or for human disease, where animals and domesticated animals and our pets develop certain types of diseases, cancers and cardiovascular disease, that can be used as models for studying human disease and treatment for human diseases, because our domesticated animals such as dogs and cats share the same environment as us and have common exposures and have potential to develop those diseases. So lots of good examples here. And here's another example where hand milking is still a standard of practice in some parts of the world. This is a picture I took in India some time ago in an area where I grew up. And I'm not surprised at all. When I was growing up, my mother used to buy milk directly in front of the house, where a guy would park his cow, milk the cow, give her the milk, and then she would then boil it and feed it to us. While you can get rid of many things during boiling, some of the Campylobacter, etc., but some of the others, other pathogens such as tuberculosis and some of the intracellular pathogens are hard to destroy by just heating up the milk. Some consume raw milk directly from the cow. They think it is healthy, but it is not. Trust me, because you can get multiple kinds of infections, including parasitic diseases, campylobacteriosis, salmonellosis, E. coli O157H7, which can basically be a killer. It's bad for pediatric infectious diseases. So when you look at the stages of evolution, many of different types of transmission have happened. For example, there's one stage that goes from animals to humans, and that's one step. And in another step where there are multiple intermediary species before the pathogen can get adapted to lead to human transmission. For example, the dengue virus, or from HIV, which came from animals to humans and then became adapted and transmissible among humans very efficiently due to our own behaviors that put us at risk of interspecies transmission or within species transmission. So there are multiple examples. These stages are just arbitrary stages, but there are in some situations we have been surprised where one event can lead to multiple within species transmission events. And we can think about some of the examples as we go through this presentation. So in my laboratory, all the work I do is directly related to infectious diseases that are transmissible among animals and humans. I'm very interested in understanding the pathogen dynamics that are involved in transmission and host adaptation principles. I work with tuberculosis, influenza, and prion diseases, specifically chronic wasting disease. A long time back, I did some work with bovine spongiform encephalopathy as well. So currently, I'm very heavily involved in all these three types of investigations. I'll give you examples of swine influenza that I've done work on, and some examples on tuberculosis. I won't touch on prion diseases at the moment. So one of the things to think about the ecosystem for bovine TB, this is one I got from Dr. Mwangi's presentation, where the ecosystem was captured really very, very well. There's shared water sources, interspecies interactions, so multiple possibilities for transmission across species and across different animal species to humans and back to animal species. So think about what happens in animal species. We don't treat animals for tuberculosis. So if the animal isolates that we get from animals have a specific resistance profile, like the pyrazinamide resistance and a specific mutation along with something else that we have seen in Mycobacterium bovis, it tells us that there has been at least one point in time when this organism has gone out of the animal species into humans, exposed to treatment regimen, and then come back into the animal species. So one of the analysis that was done was by one of my previous graduate students, awesome work there that she did, Sylvia Wanzala, when collected lots of archived isolates from the a couple of clinical trials from that were going on in Uganda, and they were all pyrazinamide resistance. Pyrazinamide is one of the frontline drugs that is used to treat human tuberculosis. And in this particular analysis, she used both genomic epidemiology and observational epidemiology to show evidence of interspecies transmission. A lot of work went into this, but I'm going to show you one slide of her data where her genomic analysis identified, just pay attention to the red cursor that I'm taking here, where we had M. bovis on this particular clade and MTB on this particular clade. Most of our isolates were Mycobacterium tuberculosis. They clustered with CDC 1551 and a couple of other isolates from around the globe, but we had two isolates that were Mycobacterium bovis, and these came from humans. They had pyrazinamide resistance. They were resistant to isoniazid as well. This one was M. bovis. This is suggesting there's been at least two major events of interspecies transmission that has happened in this particular case. There's another isolate over here that was also considered Mycobacterium bovis based on genome sequences. So another study that was done by my group in collaboration with Brazil was by Dr. Hadi and by Dr. Evan Brenner. He's not doctor yet. He's going to be very soon. He's a PhD student. And this work was done in collaboration with Dr. Basta, who is the physician who went into these indigenous populations to collect samples. That is Anam that did the work. And here's the ecosystem where the work was actually performed. That was the Mato Grosso do Sul. And the reason to do this study was that TB in these indigenous populations where healthcare is not necessarily fully available is quite high compared to the rest of the population in Brazil. And therefore, there was an interest to see if there was interspecies transmission. And we went into the area that I show here to collect samples, isolate the bacteria, and perform genomic analyses. 60% of human cases, of all the human cases in this part of the world, are clustered in this indigenous populations. And these are the two different populations where the studies were performed, the Guarani and Kiowa. And it is hyperendemic in those populations. And World Health Organization considers those as TB blind spots. So when we do the analysis with whole genome sequencing for all the isolates we had, we show that most of them cluster together. That's almost suggests that there has been a microepidemic that's happening. Also, there were a couple of different variants that were identified, and they're all Mycobacterium tuberculosis. No indication of interspecies transmission, but major indication of multiple introductions of tuberculosis into this population. Many times, these populations are very poor, and therefore they travel to urban areas to sell their handicrafts, etc., and they get exposed to TB, bring it back, and transmit amongst themselves. So the green spot and the red and the yellow spot suggests at least 3 different or 4 different introductions into this population. And one introduction has been very successful, leading to a microepidemic in that population. And so multiple ways of looking at this, correct? And I'll change gears, go into the work that we did with influenza viruses in a swine slaughterhouse in Minnesota. And remember this particular picture, many different ways in which influenza can transmit. The motivation for this particular study was there was at least two incidences where there was transmission of H3N2 variant from slaughterhouse into kids that were visiting the slaughterhouse to buy meat from that slaughterhouse, along with their parents, of course. And so we did the study with genomic epidemiology, and here's a recap of how transmission can happen for influenza. It's quite complex, and it actually can, multiple animal reservoirs can exist for influenza viruses, and many times the spillover of new variants can happen between birds and wild birds, domesticated birds, birds and pigs, other animal species, as well as birds and humans, and as well as swine and humans, in multiple different ways in which we interact with these animals. So this is Dr. Suvarnakaran. He was a postdoc in my laboratory. He came from Chulalongkorn University at that time. Now he's a professor I think in Mahidol University doing clinical microbiology. He did a fantastic analysis of genomics and genomic constellation of these influenza viruses, showing that there was emergence of multiple strains. Each of these lines that you see in different colors identify different segments in the genome of the influenza virus, and the colors identify the sources and shared relationships between those viruses. So you can see how recombination or shuffling of the genomic segments are happening as the virus sticks around in that slaughterhouse environment, transmits within pigs, and then transmits between pigs and humans. And so basically looking at the time course evolution of this particular virus, we know that we got multiple emergent isolates from this particular area in this slaughterhouse. One of them led to transmission into human beings from that particular environment. So environment can be a very good maintenance reservoir for some of the infections that could be transmitted across animals and humans. So environment should not be ignored in any kind of genomic epidemiology, as well as zoonotic disease or One Health type of studies. So again, another study that we did in collaboration with folks at Ohio State was to go visit these agricultural fairs. For some of you who don't know, these are fairs that happen. These are called state or county fairs that happen in the US across the country around mid to late summer, where they actually bring and show all their fantastic new variations in the agricultural advancements that they have made. And within these fairs, they have specific exhibits where animals are housed. So when kids come in, they want to see the animals. And when they do that, there's a potential opportunity for transmission of whatever's in the pigs back to humans. And remember, humans can give influenza to pigs too. H3N2 variant is an emergent virus that went into pigs from humans. Basically, humans gave the pandemic H1N1 to pigs that reassorted that particular virus back into an H3N2 repertoire and carried the matrix gene, which came from the pandemic virus, converted that to H3N2 virus. And this was very interesting and very important, because we then introduced optimal the ventilation, as well as certain specific science and data-based policies on how to visit animal exhibits in agricultural fairs. And here's the genomic analysis I did for this particular study, showing that multiple fairs where Ohio or Nebraska or Minnesota, all of them shared relationship with H1N1 2009 pandemic virus, and then spread also into California and Illinois. And there was a variation of some that were found in Minnesota and Iowa as well, but they were also related to the pandemic H1N1 virus that was circulating in those regions. So Genomics and genomic epidemiology can be very powerful in telling you relationships at the genetic level, but also needs information from observational epidemiology and behavioral and social epidemiology to be able to connect the dots and say, this particular isolate definitely came from this particular source versus this particular isolate definitely did not come from this particular source. So what we are trying to do in these types of studies is to establish a non-random distribution of genomics within specific groups of disease that we can actually trace back to animal species or different environmental settings. And this is another study that was done by another student of mine. She was a visiting scholar from Chulalongkorn University. Her name is Natawan Nantabenjawan. And she actually performed a time-space analysis of the H5N2 outbreak that happened, and H5N1 outbreak that happened in 2012, I believe. And then she performed a full-blown analysis to demonstrate the origins of different portions of the genome that came together to provide that high pathogenicity to this particular virus. She traced back this particular infection based on genomic epidemiology all the way back to Bering Strait and that particular flyway from where it originated, and then transmitted through human interactions and behaviors and transportation of specific types of commodities across the United States, and brought it back into the Midwestern part of the country where it wreaked havoc and created major mortality and a pressure on agricultural commodity groups as well. So this has major impacts. So imagine that if you have one transmission event, what we saw as a major impact more recently has left a lot of scars. But even before that, there have been a lot of scars left from the pandemics that have been caused within the animal species, and the potential that these can actually transmit to humans is also a concern. So with that, I'm going to wrap this up with the idea that we are living in one world. For us, one health is one medicine. We have comparative medicine, which I talked about, spontaneous models for human disease that also can contribute to emergence, reemergence of infectious diseases. And everything is not happening one-off in one person. It's happening in populations. And to be able to understand how we can actually address things in populations and understand how we can arrive at immunity that actually leads to complete blockage of transmission cycles across populations. I'm not talking just human populations here, human and animal populations. When I talk animal populations, both domesticated and wildlife population. So you have to pay attention to the overall ecosystem health in order to consider One Health as a specific type of a discipline to go after. It's very thematic, very important, and also plays an important role in how we contribute to climate change. Having said all that, I'll say thank you to all the people in my laboratory who have contributed to the work that we have done, and multiple sources of funding. Thank you to Dr. Ramji and to Dr. Ching for inviting me to share what my thoughts about One Health in this particular presentation. I can take any questions, or if there are any specific points or ideas you want to share, I'd be happy to take those now.
Yeah, thank you. Thank you so much, Sri, for your excellent presentations. Colleagues, if you have any questions, please, could you please post those questions in the chat box so that Sri would be happy to answer, your queries. And we have 20 more minutes. We can spend the interacting or, discussing those questions that you may have. And in the meantime, Sri, I have a couple of questions. I think our colleague would also be happy to listen from you. Well, what are you explained nicely about several research that you did in your lab, and at MSU and University of Minnesota. And what are the very new tools that are being used in One Health that our colleague in Mekong regions can adapt or adapt? Could you please shed light on a couple of those that you find useful?
I'm sorry, I didn't understand the last
Tools,
part of the question.
Tools, One Health resource related tools. This is very vague questions, but yeah.
Can you give me a perspective of what tools you're referring to? I do understand there are multiple ways in which one could approach this, but if I guess I'm not understanding.
Oh God, yeah. It could be about the diagnosis,
Oh,
diagnostic tools. It could be about the training or the capacity building. Yeah.
yeah. So yeah, training and capacity building are key to addressing One Health, and that's primarily because once we have expertise that has already been placed through training and intentional identification tools that can be established. So in terms of diagnostics, there's still a long way to go. But the newer devices such as the nanopore technology, as well as other technologies that can actually do de novo genomics or do on-site diagnostics are still very useful. But then you have to be able to tell the difference between the source identification. If you recap the recent pandemic that happened, there's so much debate and question over the source of this particular virus, correct? And for that, you have to be able to say this virus or this bacterium or this parasite definitely came from this particular source. Sometimes that source is unavailable, number one. Number two, there has been sufficient host adaptation and evolution that's happened within a new host that you're now unable to trace it back. So no amount of intentional diagnostics based on conserved regions of the genomes will be able to tell that interspecies transmission unless you're able to do both genomic tracking and observational epidemiology tracking and some of the social behaviors that go into that interspecies transmission that may happen. So all the tools are important, and it's more important is the capacity building part of it, where there's local talent that goes out and does the sampling, etc.
Thank you so much, Sri. Colleague, we have here with us Dr. Irfan Furkan Irfan with us, our colleague. Team, myself and Furkan, we jointly work in this project. Furkan, please take over the Q&A.
Thank you, Ramji. I see Dr. Wonafon's hand is raised. Dr. Wonafon, would you like to go ahead and ask the question?
Hello. Yes. So hello everyone. Thank you. Sri Wansan. I don't know I pronounce is true or not. So sorry. Yes. Sri, right? Sri.
Yeah.
Sri Wansan. Yes. Thank you for your presentation, and thank you for your you talking about a lot of research and talking about a lot of lab research and ecosystem health, relate to a multidisciplinary approach. Yes, very good, and relate to our network as well. Now we am from Lahun, one coordinator from Laos. That we have Lahun, and we collaborate with Sihun network as well. And that this is a good chance to get your information. So it's not really the question, but I try to experience with you about when we talking about ecosystem health, just relate to environmental science as well. So how about your idea about when we talking about environment science or environmental work related to One Health? Okay, did you have the idea or did you have the experience to share with us about this? Thank you.
Yeah, the environmental health / ecosystem health is extremely important. and it's very thematic because there are multiple angles at which it needs to be approached, and each of the angle is different for different ecosystems. For example, what happens in Brazil, in different parts of Brazil, versus what happens in Vietnam, Laos, and Thailand in that particular area is very different because the ecosystems are quite different. Say, I'll give you an example. We love to bring animals from exotic areas of the world and put them as exhibits in zoological gardens or zoos across the developed world, so people can actually come and see what exists out in other ecosystems. And by displacing animals over, we are unable to maintain their dietary requirements that is available in the local setting, and therefore we change how they are able to assimilate, and we cause new diseases in those animals, meaning there could be simple things like a GI upset. They become susceptible to other types of diseases just because they're being exposed to other types of animals. So maintenance of local ecosystems are very, very important before a global initiative can become successful. Having a global initiative is important about addressing environmental health and ecosystem health, but locally, each one of us is responsible to maintain through data-driven as well as locally available resources to invest and maintain ecosystem health and environmental health. That would be dependent on some of the programs that you all have. And that's where the question about capacity building becomes very important. Having that capacity building and having the resources available locally and having local governmental support to perform these types of activities is very important. And I think a good initiative to maintain ecosystem health will also basically tone down the interspecies transmission events. Do you have?
Thank you so much for your sharing. Yes, yeah, thank you so much. Yes, that's very interesting because in our region, when we're talking about the environmental information, yes, when it's quite rare, just like you share like this, I think is really good for our network and for our research as well, I think. Thank you.
I saw a question on the chat about how this multidisciplinary approach is involved in One Health concept. In fact, actually, One Health by definition is multidisciplinary and cross-disciplinary. It's a truly an interaction, like I said before, behavioral scientists and social scientists who actually understand how people in different parts of the world interact with their own environment, their own animals, and their people. It also involves people who are physicians, veterinarians, as well as folks who are epidemiologists, diagnostic medicine folks. So you have to bring in a team that involves multiple expertises in order to address One Health, and you can't I can't overstate what I mentioned in the previous for the previous comment question about the importance of impacts of changes to the environment and the ecosystem that becomes important in transmission events. So we need environmental biologists, we need zoologists, sociologists, behavioral scientists, as well as veterinarians, physicians, and epidemiologists to be on the team to address this.
All right, thank you, Sri. One question I have, if there are no more questions in the chat box, is especially in the developing countries, Sri, there is a resource limitations. For example, resource means all, the capacity buildings, all sort of things, Also, because of that, there is, minimal training and other opportunities for advancement or learning, So in South's case, it is very challenging for them to pursue One Health, approach. So any suggestion, how they should handle? Are there any, global platform where they can reach out or resources?
Yeah, the major resources that exists even in globally are sort of separated by human health and animal health. The FAO, the OIE are more human health related, and the reporting of diseases in animal health, animal related diseases to OIE happen and in some parts of the developed world, but they're not necessarily active surveillance data that's available for animal health in those regions. World Health Organization maintains a much better database of emerging infections in human populations, et cetera. I think there has to be a convergence between those groups to be able to talk about data that's coming in real time. Also, intentionally educate different developing countries to be able to collect data on a regular basis, increase capacity to be able to do more state-of-the-art diagnostics in those areas. We understand that some of the remote areas of the world, certain tools are not available. The important thing is to recognize you can't go, say, for example, I go from here to Costa Rica and say, hey, you guys are doing it all wrong. If you say that, it is automatically a dead on arrival type of an activity. You have to go there, observe, and then identify potential risk parameters, attributable risks for interspecies transmission, and build education that is relevant to the local level, rather than building education and resources that are universal. We think about some things are available and not available in this particular area, so I'm going to send these resources over there. But the same things may not apply to other parts of the world. So you have to balance all the investments as well as education and resource development and capacity building based on what's available locally. One of the biggest examples I can give you is how, for example, US invests in different parts of the world. They want to make sure that there is good investment in both health and agriculture and economics of certain parts of the developing world to be able to make those local areas self-sufficient for people. So there isn't a problem in fleeing your own ecosystem to a different place to be able to establish in a new geographic as well as social settings where you don't appreciate all the appropriate activities. But locally, if we're able to invest and we are able to build capacity and educate to things that are relevant to those areas, would make it so much more impactful. So there's the basic answer is the one key doesn't fit all locks. So you have to make sure that every lock has actually an identified key. You can't have a master key really in this case. There are some universal concepts. Within those concepts and systems, we can actually develop programs. But then what applies locally, you have to pay attention to those minute details to make any of these ecosystem health, One Health activities to be relevant and to be impactful.
I have a question 3. This is great. This is great answer. I really appreciate that. One question that bring back to the presentation, you mentioned about outbreak, possible outbreaks in future because of this the fairs, like county fairs, city fairs. One of the reasons that this great initiative to bring animals to, bring kids and then get them familiar, especially the kids growing up in urban settings, right? Encourage more children, the future generation, to be in part of the farming, the dwindling business in the United States and other part of the world. So because of outbreak, have you seen kind of scrutiny over, before the fairs to make sure the animals brought to the fairs are healthy? So, because, all these, zoos, the exotic animals, I see children like want to touch, and my children also want to ride something, right? Just the feeling that it's intimacy between animal and human being. So any new policies?
Well, I can give you examples of things that were introduced, say, in the Minnesota fairs and Ohio fairs, etc. Again, this is so locally very dependent on what happens at the local level, because state fairs are one thing, county fairs are a completely different thing, and everything comes under the Department of Health and Human Services as well as Department of Agriculture. The Department of Agricultures across the country have specific guidelines for animals that are exhibited in state and county fairs. So there is a health check that happens. But consider this, well, after they come to the county fair or to the state fair, they're now exposed to animals that have come from different areas of the state. And they're being housed in a similar, in a confined setting where they share that specific microenvironment, if you will. And now that interspecies transmission is also happening. If there are animals that came with a subclinical infection, they start becoming clinical because of the stress of transportation, as well as interaction with other animals within that exhibit. And then consider that humans that are coming to the exhibit to interact with the animals, maybe bringing in certain types of viruses that could be transmissible, say, for pigs to cattle, etc. They become sick, they incubate over a period of a week or 2 weeks that they're exhibited. They are actually at different stages of the disease process, and they're transmitting that amongst themselves into humans, and humans back to animals. So there has to be a real-time surveillance system that exists in those exhibits, where it's not just before they come in. If we do have those specific testing parameters established, but then when they come in, they're remembering that it's a dynamic environment where there's a lot of interaction, and to understand what else may be needed to surveil in real time. This is active surveillance that needs to happen at the exhibit. So Minnesota introduced this aerosol surveillance protocol, where they have these huge filtration devices connected to lollipop devices that have fans that collect air on a regular basis, and every hour or so they take the sample in for testing to see if there has been transmission of, or if there is a viral load of influenza viruses in that particular environment. They can do it for multiple other animal viruses as well. And there is a periodic nasal swab sampling process that happens to make sure that the animals are not necessarily exposed to specific types of viruses, and if they are, to remove them from the exhibit, and to monitor other animals that were in the exhibit, and so on. So there are some ideas. It's not very widespread in terms of its application. An important thing is to recognize that there's a dynamic environment. We need to be able to do this in real time and consistently. The consistency is so important. All you got to do is turn away from it once, and there can be a breach in the surveillance that leads to a transmission cycle.
Thank you, Sri. Thank you so much for this insight. We have Dr. Phuc here. He is One Health, University coordinator from Vietnam. He has done a lot of works in wildlife trade, especially livestock and livestock product trade. And I have also attended a couple of presentations, wherein he has highlighted those, issues. Would you like to, share your thought, Dr. Phuc, in a couple of minutes? Because the country fair things, the human and animal interactions, and also there are social interaction happening in wildlife or livestock market in several areas in Mekong region, which is a very big issues here, and also the hot area for this interspecies transmission.
Yeah, what can I say about that's a whole new presentation, animal markets, and multiple transmission events that can happen in animal markets. In fact, I traveled when I was in Thailand, in that particular area, into animal markets, into slaughterhouses, multiple potentials for interspecies transmission. Here again, the most important thing to recognize is there are exotic animals that are in animal markets that are being sold. I've seen wild birds and reptiles, etc., that are sold in those animal markets that provide multiple opportunities for transmission of things that we have never seen. Our immune systems are naive when it comes to these types of organisms that are floating around in other animal species. We can't go and tell people that they shouldn't have live animal markets. We have to evaluate why they have live animal markets and why that is important part of their diet or their social behaviors. For example, there is a specific type of a behavior where it's called a wishing bird thing, where exotic birds, very colorful birds, are actually sold in markets right around New Year. So people come there, take a bird, pay for it actually, kiss the bird and release it with the idea that their wishes that they have in their minds will be taken to heaven and they'll become a reality. And while that is a practice and that is fully respectable, there's also the potential for transmission of certain things that the birds have, Campylobacter, Salmonella, influenza, etc., into humans. And so we did a lot of surveillance in that area. Went to Hong Kong to live animal markets as well. There is a lot of potential for transmission, but there's another way from our educational perspective that we can actually provide is certain behaviors can be muted, but another type of behavior is to make sure things are cooked well before they eat. That's one major parameter that has made a difference in interspecies transmission, at least to begin with, and interacting with animals, and then washing hands and basic hygiene is so very important.
Excellent, Sri. Folk, do we have any addition, or shall we go to?
Thank you very much, Professor Sri. I think all the things you have mentioned were very true. The same in Vietnam. And you see that in the wet markets, they sell everything, including the live animal, including the wildlife like rats, they go around. Also very, that the hygiene condition in the market, so very, very poor. It for me that nothing is a treatment system. And even it's a water supply for the people, they are washing hand, no, not enough.
Yeah.
So that at the moment we are conducting one research on food safety at wet markets. So we testing E. coli and Salmonella. It's a crop contamination very high in the butcher when they sell the pork meats. So we see that very difficult to provide some feasible intervention, how to change their behavior and practice. So as you mentioned, that the good point is the culture of people, it's a food consumption in Southeast Asia, actually in Vietnam. They prefer eat hot meats. They don't want to eat cooling meat. So we see that I don't know how we can change. So that One Health concept, I think it could bring forward the idea, provide more concrete evidence. It's from different sector. So before we are it's a human health sector, agriculture sector, we are separately, we cannot enough evidence. So now if we work together, I can bring it very concrete evidence and to change behavior. So that I'm thinking that One Health concept is very good for infectious disease or zoonotic disease. But for me, it may be more broader. It's a NCD. So how about hypertension or diabetes? You can use it's One Health concept because people with a food behavior change, also the lifestyle change. So can we use the One Health concept to addressing this issue or not? But I see that in the future, we need to thinking more broader, not only in the infectious disease. So that's from my side. Thank you.
Yeah, thank you for sharing all that information, because I think that's so relevant to the discussion here. And that's why I said, local practices have to be evaluated for what is relevant locally before you institute any kind of intervention strategies or mitigation of specific conditions. There may be certain resources that are not available locally as well. So as to your point about chronic diseases, I did mention about comparative medicine as a part of the One Health concept. You've got to remember that many of our chronic diseases have very strong connectivities to our ecosystem as well as our own behaviors in terms of what we are exposed to. One mistake we don't want to make is what we call as ecological fallacy. In epidemiology, it's a very big deal because an association, for example, salt consumption and blood pressure. We know that increased salt consumption, at least in the US studies in the ecosystem and in the developed world in general, increased salt consumption is a risk factor for increased blood pressure in those populations. But in other populations, cardiovascular events related to blood pressure, for example, in Japan, where salt consumption is very high, is not really a problem. So can it be both a risk factor and a protection factor that protects people from cardiovascular events? No, it is true that it is a risk factor, but it's just that there are other risk behaviors. These are called competing causes hypothesis, and there are other issues that the people are exposed to, and there are other chronic conditions that are more relevant to that local setting. Type 2 and type 1 diabetes. Type 1 diabetes is genetically associated, but type 2 diabetes, like you say, is very tightly associated with social and dietary practices. And we do know that through multiple studies that you can actually control that through centralized policies about how food is distributed in the country and how and messaging through, this is where social behavioral scientists come into play. They are the ones who will be able to give us tools as to how we can message to different populations to make a difference. So I'll give you an example about Minnesota Heart Health Survey and how they actually went about. After the first round of the survey and the cross-sectional analysis, they identified these risk factors for cardiovascular disease. There were many different modalities by which outreach happened between behavioral and social epidemiologists. They used radio messaging, television messaging, and in-person messaging. And they would actually hold fairs where they would have people come in, they'd give them gifts to come in, and then give them a lecture about how these types of practices have potential to lead to. So giving them specific examples that are relevant to that local setting is so much more impactful than actually saying, oh, that's how it is done in the Western world or the developed countries, and therefore these should apply to the developing countries as well. I think there's a flaw in that thinking because that is an ecological fallacy. So I agree with you that we have to do it at a local level.
Thank you so much, Sri. Let's wrap up now.
Sure.
Folks, by the way, I mean, this is for this reason we are organizing these kinds of webinar, to discuss the practical aspects of the public health issues, animal health issues and environmental issues, how we can bring those together and help the health systems, And so we will be organizing this kind of webinar every month through our programs. So, but please, check in our website and keep, check the email that our colleague will be sending in due course of time. And next webinar is scheduled on January 9 on antimicrobial resistance from one of our colleague faculty from MSU. We'll soon be, advertising it through the flyer. So finally, I would like to request Wanapon for your short remarks, in a couple of minutes. And then our colleague Ching will give you thank you note, then we'll wrap up.
Oh, okay. Yes.
Yeah,
thank you so much. Thank you.
I was going to just say there was a note in the chat. I have seen it. I have copied the email address. I will be in touch.
Thank you so much, Sri.
Thank you. Good day, everybody. Good night.
Thank you, Sri.
Thank you, Sri.
Thank
Have
you.
a good day.
Bye.
Bye-bye.
Go ahead.
Wanapon, you want to say something?
Yeah. Thank you so much. Thank you, Steve. Thank you because he is already left. Yes. Thank you so much for everyone. Thank you for all of us. thank you for all our participants for this webinar. So I hope yes, this webinar, the second webinar will bring you on the information and make you interest on One Health approach and One Health concept as well. So I think today we got a lot of information and we share together about the ecosystem health and how to involve the mini-disciplinary to working together. I think that's good chance, and we hope to see the third webinar in next month, so we can share the experience together again. For today, thank you so much, and thank you for all of participants, and thank you for Sri again for your sharing information. Yeah, thank you so much. For Lao Hun, yes, we also keep on the One Health concept in approach for doing many kind of work related to One Health. Yes, thank you so much.
Thank you. Yeah, finally, Ting, go ahead and wrap up.
Thank you, everyone. We have a very lively discussion and a great presentation from Dr. Three. This is very helpful, very intriguing information and knowledge. And I see a comment from the question and answer as key. Please see, I can pronounce your name correctly. Please send your email, send a message to me. We will stay in touch to, comment on your research interest. That would be great. And everyone, thank you and have a great day and good evening. And we are having you're having a survey. Please remember after we end this webinar, please do answer if you can or you want. And we will we look forward to seeing you in our next webinar in January. Thank you.
Thank you, folk,
thank you.
and thank you, Onafon, and thank you all.
Yes, Vanafon and Folk, thank you for being here. Very, very great. It's great to see you.
Yeah,
I
nice
will
to see
end
you
this
on. Nice to
now.
see you.
Yeah, we'll stay
see
in
you.
touch and send emails if you have any other comments and thoughts. We would really
See
appreciate it.
Varafon in Malaysia next week.
Oh,
Okay, see you then.
Take
See you.
care.
Bye.
Happy New Year,
Bye.
everyone. Happy
yeah,
holidays.
Happy New Year
Bye-bye.
and holidays.
Mỗi lần phải